Hi, I'm trying to make a video just to demonstrate the use of Emax or lithium disilicate as we all know. There are a few cases in which I would not like to compromise on the quality of treatment. Now, what I mean by that is, just for example, this is the case of a child, a young, I think around 8 or 9 years old kid whose lower molar was decayed. So we performed the root canal treatment on this tooth. After the root canal treatment, now the challenge arises. So what the challenge was is regarding the residual tooth structure or the tooth structure that is left after we do a root canal treatment. Now, just to demonstrate, just to show you, I'll bring this closer. This is the 3D model. This is the 3D model of the scan that we got made from the lab. This is the root canal treated tooth that I'm talking about, this one. So if you watch closely, I have marked, I have done a particular, I have marked the area with this pen, and this shows the amount of decay that was present on the tooth before we started the root canal treatment. So imagine if this is the amount of tooth decay, we perform a root canal treatment. I have placed a composite restoration inside the chamber. Now imagine if I am going to do a tooth preparation for a full coverage restoration or a full crown. So imagine if I will be reducing around 1.5 millimeters of this buccal tooth structure, the lingual tooth structure, and the proximal areas. So what will be left? What will be the residual dentine thickness or the residual tooth structure that will be left after a tooth preparation? Nothing, right? So in such cases, what is the best idea? What is the best we can do for the patient is we can get a Emax only made. Now what we do for that is what I did is I have just performed the occlusal reduction. Just see there is a space of around 2 millimeters. I have done a tooth reduction or the occlusal reduction of about 2 millimeters. I have prepared the tooth for receiving an Emax only, and I have not even touched the buccal surface, the buccal wall. I have not even touched this buccal surface. Or the proximal area I had to prepare because there was some cavity in this area. But this side, the distal side, I have not removed any tooth structure. And on the lingual, we had minor tooth structure left, so I did not touch that. So we have some enamel left all around, circumferentially around this cavity, right? Around this restoration. So this is how we use the residual tooth structure or the enamel that is left just to bond an Emax only. Now this prolongs the life of the tooth drastically, right? If we had performed a complete tooth preparation around this tooth, you can imagine there would have been no tooth structure left. So this is the photograph of the Emax only that we got made. Um, and this is the final photograph. Now you can see in this photograph, this is the onlay that has been cemented or bonded, right? Now there is a difference between how we lute a crown and how we bond lithium disilicate. So this has been bonded, and this, if you can see in the photograph, this is the tooth structure that was left. This is the intact tooth structure that would have been removed if I had performed a complete tooth preparation for a full coverage restoration. So this is how we can preserve very important tooth structure just to prolong the longevity of the tooth. So let me know if you have any questions in the comment section. Cheers.